Whether you're preparing dinner or just fixing lunch for the kids, we rarely give much thought to our time in the kitchen. And because of that, hand injuries are all too common in the kitchen. Dr. Mark Deitch, an orthopedic and hand surgery specialist with OrthoMaryland, joins us this morning to talk a little bit about some of the things that can happen and what you should be aware of. And just sometimes it's common sense, but sometimes more than that. Good morning.
Good morning.
All right, so what are the most common types of injuries that you see from people who are in the kitchen and then at the hospital?
By far the most common injuries are injuries with knives or sharp objects in the kitchen. People have cuts to their hands and their wrists that occur during the course of preparing food.
And anything that's going to be sharp could cause a problem, something you wouldn't even think of, like the can openers, the cans.
Absolutely. And there are some simple things that, that you can do to take care of that. There are a can opener, for example. This is a can opener that is a rim opener to this can where it opens the can. Everybody's familiar with those old can openers that leave that sharp edge. This actually opens and leaves the rim on so that there's no sharp edge for you to cut your fingers.
Word of precaution so they don't end up having to come see you. And especially now this time of the year, everybody is about to carve a pumpkin. Do you have tips so that they can do it a little safely?
Absolutely. A lot of it is common sense. Never put your hand opposite where your knife is. And that's true.
That's how you get a good grip, doctor.
It is, but you need to just reposition your hand. People always cut their non-dominant hand because they're holding the knife in their dominant hand, and they try to get that extra little bit and push down, and then something gives way and the knife goes into the hand. That's true whether you're cutting a loaf of bread or if you're cutting into a pumpkin. So just reposition yourself, take your time. You can use a little bit of a sawing motion to cut things rather than pushing through things. Never hold your hand opposite where the knife is.
You know, the cutting and the knives, obviously the most common way to be injured in the kitchen, but so many other ways. I mean, burns easily, you touch on the stove, but one of our coworkers is always talking about steam injuries. People don't think about that, but how common?
No, that's very true. Steam injuries are very common. You're boiling water to make spaghetti, and that's sitting on the stove. You might have something on another burner on the stove and reach across. There's a lot of hot air, that steam that's coming up, and can certainly cause injury, burns the skin. Or when you're pouring something into the sink, it can splash up and burn you. Again, it's being careful, being aware of where the hot objects are, and positioning things appropriately, taking your time when you're pouring things out and that sort of thing.
And even using the microwave, you think of that as, you know, you're less near the heat of a stove, but if you put something in there and open it and go to peel the top off, that microwave got it pretty hot, so that steam's going to be in there too.
It's very true. Not only that, if you put a porcelain dish into the microwave, that porcelain dish gets very hot also. So treat it like an oven. Pick it up with oven mitts or some sort of protective device, a towel or something.
All right, not that you're not the nicest guy in the world, but you don't want all these people coming to see you. You want them to be safe.
Not. Absolutely.
Doctor, thank you so much. Well, for more information, you can go to our website, foxbaltimore.com, and click on Your Health Matters.